Hello there. Today, we'll be learning about irritable bowel syndrome, also known as IBS. This video is for educational purposes only and is not medical advice. Let's begin with what is irritable bowel syndrome, IBS. Irritable bowel syndrome, IBS, is a common disorder affecting the large intestine, the colon, and characterized by a combination of abdominal pain, bloating, and changes in bowel habits. Here's an interesting fact about irritable bowel syndrome. IBS is one of the most common gastrointestinal disorders, affecting up to 10 to 15% of the global population. So, how do we know if someone has IBS? Let's take a look at symptoms. Number 1. Abdominal pain, discomfort, and/or bloating, typically in the lower abdomen and often relieved by passing stool or gas. Number 2. Altered bowel habits, such as diarrhea and constipation. Number 3. Changes in stool appearance. Stool consistency may vary, appearing loose, watery, or pellet-like. Number 4. Urgency or incomplete bowel movements. Feeling the need to have a bowel movement urgently, a sense of incomplete evacuation. If left untreated, complications can occur, such as fatigue, impaired quality of life, physical discomfort, emotional distress, and limitations in daily activities. Number 2. Psychological distress, anxiety, depression, and stress-related disorders due to the chronic nature of their symptoms. Number 3. Malnutrition and weight loss. Severe IBS cases, particularly those associated with chronic diarrhea, may lead to nutrient deficiencies and unintentional weight loss. Number 4. Hemorrhoids. Frequent episodes of diarrhea or constipation can increase the risk of developing hemorrhoids, which are swollen blood vessels in the rectum or anus. Early detection is key to preventing this condition from spiraling out of control, leading to complications. Go to your doctor. Here's what your doctor would typically do to diagnose irritable bowel syndrome, IBS. Number 1. A medical history and symptom assessment. A healthcare provider will inquire about your symptoms, the frequency of those symptoms, and any associated factors. Number 2. A physical examination. The abdomen may be examined to check for tenderness, bloating, or abnormal masses. And finally, number 3, a diagnostic test. These may include blood tests, stool tests, imaging studies such as an abdominal ultrasound, or endoscopic procedures to rule out other conditions with similar symptoms. It's important to work with your doctor to determine if you indeed have irritable bowel syndrome, IBS. Do not fear tests. It is crucial and may impact your prognosis and long-term outlook. As we always say, prevention is better than cure. Here are some ways you can prevent irritable bowel syndrome, IBS. Number 1. Identify triggering foods. Number 2. Manage stress. Number 3. Maintain regular eating habits. Number 4. Stay hydrated. And number 5. Increase dietary fiber. Again, prevention is always better than cure. If there's one thing you can do today to help raise awareness, please screenshot and share this with your friends and family. Alright, that's it for today. See you next time.